you for joining both Kevin and myself this afternoon, and we hope you find it meaningful. For those of you who submitted questions to Kevin when you registered, we have collectively looked through those questions and embedded most of them into the presentation, and then I have a couple slides at the end which just pinpoint the answers to those questions. If during the session a question comes to mind, just put it in the chat. Kevin will be managing the chat and he will ask me those questions towards the end. We've saved some time for that. So for those of you who don't know Kevin, Kevin is my right-hand man. He's the senior consultant for talent acquisition at Stanford Healthcare. He does all of the nurse recruitment and marketing efforts for the Stanford Healthcare Nurse Residency Program. So if you're not following him on social media, I highly recommend that you do. He will blast when the application posts, when interview calls are being made, when our next cohort's starting, what the questions on the application are. He usually posts that. So you don't have to go back and forth within the application. So he's a great resource. So please reach out to him or follow him on social media if you're not already. Again, my name is Kerry Zoss. I was a new grad at Stanford 15 years ago. So I have been in your shoes. And so I'm super excited that my career kind of had a full circle moment from clinical nurse to manager into education. And now I get to work with all of you guys and bringing you into this wonderful organization. And if not Stanford, then hopefully helping you to find the perfect spot so you can begin your nursing career. Today, we're going to focus on two main concepts. One is all about the Stanford Healthcare application. So what are the requirements? What are some of our recommendations and tips regarding the application, the process, and then we're also going to talk a little bit about the program itself. A lot of questions I got were on the timeline for our cohorts for the next year. How do we place people clinically? What impact has COVID had on our program? And what are our goals, curriculum, and structure? So I've embedded